Hello, welcome to today's web chat about marijuana. Thank you for joining us. My name is Ed Bottomley with the Michigan Medicine Department of Communication. The Michigan Regulation and Taxation of Marijuana Act, also known as Proposal 1, was passed by the voters of the state of Michigan on November the 6th, 2018. It became a law on December the 6th. The law allows for the personal possession and use of marijuana by persons 21 years of age or older. Now that recreational marijuana is legal in Michigan, what should you know about its health effects? That's why we have our experts here with us. We'll introduce them in a moment, but first a few housekeeping items. You can submit questions at any time, even now, for our panelists to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please know that if you do comment, your name will be visible to everybody else in the chat. We're not going to mention your name on here in any way, but just please know that it will be visible to others participating. If you prefer a more anonymous option, you can also send a private message to us via Facebook. If you can't stay for the whole chat, or if you want to share the recording with a friend, a video of the chat in its entirety will be available on our Facebook page, and we'll also be loading it up to our YouTube page soon after. So, on to our expert. We have three Michigan medicine experts here to answer your questions today. If you guys could just go, if we could go down the line, just a short introduction from you all.
Okay, I'm Dr. Megan Martz. I'm a research fellow at the Addiction Center within the Department of Psychiatry here at Michigan. I primarily research adolescent brain development in relation to substance use risk and resilience, focusing on alcohol and marijuana use. For example, one of the studies I'm working on is a nationwide study following 9 and 10-year-olds over the course of 10 years. It just started. It's called the Adolescent Brain and Cognitive Development Study. So I'm really interested in longitudinal research, impacts of substance use on the brain, and also risk factors that might pre-exist certain people toward that.
Fantastic.
My name is Meilan Han, and I'm an adult pulmonologist, so focusing on the lungs. And much of my research actually focuses on the effects of tobacco smoke and the lung. But there, as you all know, are lots of types of smoke. So today we'll be talking about the effects of marijuana on the lungs.
And my name is Dan Claw. I'm a rheumatologist in the Department of Anesthesiology. I lead a large pain research group called the Chronic Pain and Fatigue Research Center. And our group is very interested in the medicinal benefits of cannabis, especially for the treatment of chronic pain.
Thank you for your intro. Let's start with the questions. I know we have a variety of different specialties here, so if you can't answer the question, we'll pass it along the line. First question, what are the physical effects of smoking marijuana? Does anyone want to take that?
I'll take that on.
Thank you.
So the endocannabinoid system, the system within the human body that binds to the cannabinoid molecules that your own body produces, is widely distributed through the human body. And so most people, when they think of cannabis, they think of some of the side effects like getting high or getting the munchies, or they think of some of the potential therapeutic benefits, such as in treating pain or treating seizures, which are some of the well-described benefits. But it turns out that the body's own internal cannabinoid system does a lot of things. It affects memory, it affects stress, it affects sleep, it affects a lot of different things. And so people need to be aware that when they're taking cannabis, that there are receptors within the human body that binds to that do a whole bunch of different things. And that what leads to a lot of the effects, both good and bad, that occur from smoking or ingesting cannabis.
Is it a question, if I go to the pub and drink a couple of beers, is it a question of certain people can take more marijuana, or it has different effects on people?
Yes, so marijuana, people will fairly rapidly, like a lot of drugs like opioids, or will fairly rapidly develop tolerance so that they need to take more to get the same effect. That actually doesn't happen to any significant extent with alcohol. You can upregulate the enzyme that breaks down alcohol, but an alcohol blood level of 0.10 will make everyone somewhat impaired. A level of 0.20 will make everyone really impaired. There is no relationship at all between someone's cannabis blood level and how impaired they are, because a chronic smoker can have a very high cannabis level and not be impaired at all. And someone that's cannabis naive, that's never smoked before, could have a very low amount of THC and be quite impaired.
See, that's fascinating.
And relating to someone that has never used it before, using in high doses, there's actually been research showing that people have increased likelihood of experiencing panic attacks or high levels of anxiety. And a lot of times when you think of marijuana, you think of it relaxing you, but especially in young people and people using it for the first time, they might actually have increased anxiety, especially in high doses.
Fascinating. The next question that we have, is smoking marijuana less harmful than smoking cigarettes?
Answer that one. So interestingly, we actually don't have quite as much long-term data on smoking marijuana as we do cigarettes. It's a little bit more difficult to quantify. There's a lot of ways that people might inhale marijuana, whether it's a joint or a bong or vaping now, as opposed to cigarettes, which are a little bit more quantifiable because patients typically get cigarettes that are the same size and they know how much of a pack they've taken and can kind of report that over time. It's much more difficult to get information on marijuana, particularly since it is not been legal either. So the data that we have on smoking marijuana just isn't as good. So what we do know is that it irritates the lining of the lungs and can cause kind of increased mucus and a chronic cough and phlegm production. So it's irritating to the airways. We do know that if patients, for instance, smoke marijuana and tobacco, it can actually make it worse. Or if patients have a history of asthma, smoking marijuana can actually make the asthma worse. There actually are also a lot of carcinogens or cancer-causing compounds in marijuana, and so there are also some of the same theoretical risks to smoking marijuana as there are to smoking cigarettes with respect to development of lung cancer. Having said all that, we don't have great long-term data for all the reasons I just mentioned on smoking marijuana to whether it definitively causes some of the same things that tobacco causes. So for instance, chronic obstructive pulmonary disease or emphysema or even lung cancer. We just are lacking some of that long-term epidemiologic data, but the theoretical risks are certainly still there.
That's very interesting. You touched on other inhalation devices. The next question that we have says, what about using bongs, vapes, other inhalation devices? What are the risks there?
So for any way of smoking marijuana that results in smoke, that's going to be a bit more damaging to the lungs. Smoke in general is actually damaging to the lungs, whether it's cigarette or not. Interestingly, even being exposed to wood-burning stoves, some parts of the U.S. actually use wood-burning stoves a lot. Even that is associated with developing chronic airways disease. So in general, regardless of where it's coming from, smoke is bad. There's a little bit less theoretical risk for things like vaping, just because it doesn't generate those same burnt compounds in the smoke. Having said that, again, there are a lot of other compounds in marijuana, including carcinogenic compounds that are still going to be taken up by the body. So I wouldn't say, at least for some of those theoretical risks, that there's any necessarily completely safe way of taking, inhaling marijuana that comes directly from plants.
Thank you for that. The next question that we have, what risk does marijuana pose to kids and teens?
Yeah, I can talk about that. Yeah, so what we know is that typically for all drugs of abuse, alcohol, marijuana, that the earlier you use, the more damaging the effects tend to be. So what we're really concerned about is earlier use. Usually what we say around age 14 is typically what we define as early use, but some kids are actually using before that. In relation to brain development, which is my area of focus, there's certain areas of the brain, particularly in the prefrontal cortex, the frontal area of the brain, that are associated with cognitive control, decision making. So really important skills, especially for young people as they're learning and make decisions in their lives. And those areas of the brain don't really fully mature until actually the mid-20s. And so we are especially concerned about that in relation to what kind of effects we are seeing in the brain. And the research in our lab has found in particular effects of marijuana use on the reward areas of the brain, so how people process and interpret rewards, and also in terms of emotion processing. So we are seeing some impacts. We don't really know how how long these impacts are on the adolescent brain. But again, so the studies like the Adolescent Brain Cognitive Development Study, the ABC study, hopefully we'll be able to have a better understanding of the long-term impacts on the adolescent brain, especially if they've started using early on.
Great. The next question we have, this is an interesting one. With regards to emotional status, someone says, is it fair to say that smoking marijuana is good for violent people to keep them at an even level? I imagine in terms of emotional status, in terms of calming someone down. Does anyone have any answer to that one? It's probably a tricky.
Yeah, I don't think that would necessarily be a quick fix to it. I think because, like you were saying, it can have different impacts on people, and especially the dosage too. If you're having a very high level dosage, it may not have that calming effect necessarily. And if you're interacting with other substances too, you may not see that.
I don't think any of us would feel comfortable saying that that's a known medicinal benefit. I would say, though, if you interact with police officers or things like that, they will say that they don't find the people that are high to be nearly as problematic as the people that are drunk or using other drugs, because they will be more. But again, having said that, I think any of us are advocating or recommending as a treatment. No.
The next question follows on a little bit from what you spoke about, Dr. Martz, with regards to the risks. What should parents tell their children about marijuana use?
Well, I think any kind of psychotropic medication you're taking, whether it be legal, illegal, it changes the way the brain processes information, and it can have effects, not only physical effects, but psychological effects as well. So I think just being aware of, trying things early on, because it can have impacts on your brain. And I think especially at a time when it's a very sensitive period in terms of brain development, and it's not worthwhile to add in external substances that might have a negative impact on your brain.
Thank you for that. The next question, should marijuana be used to treat aches and pains?
Well, the first threshold is, there's a lot of things we can use to treat aches and pains that are not drugs at all. There's a lot of non-drug therapies that can be quite effective for treating pain. Exercise is probably the singularly most effective therapy for treating any type of chronic pain, getting better sleep, reducing stress. So but when we move into medications for treating pain, we don't really know exactly where cannabis would lie, but I do want to make the distinction between the two elements of cannabis, one being CBD or cannabidiol versus THC, which is the psychoactive component of cannabis. There are a lot of emerging studies that CBD alone can be effective to treat pain. And CBD has virtually no side effects that we know of right now. It's not psychoactive. It has no addictive potential. It really doesn't have hardly any side effects. And so if people are moving in the direction of cannabis to treat pain, they should try CBD alone, and then perhaps a high CBD, low THC form of cannabis as the preferred constituents of cannabis that would be most likely to treat pain. A lot of people right now are using the high THC forms of cannabis to treat pain, and they're overshooting the dose that's effective to treat pain. A low amount of THC is more effective than a high amount of THC to treat pain. And what we see, if people don't watch programs like this and get medical guidance about how to use cannabis appropriately, is they're going to the dispensaries, which are used to catering to the recreational user. They're dispensing mainly these very high THC strains of cannabis or of the edibles or whatever, and those are not at all the strains that people should be using for most of the medicinal effects of marijuana, especially the analgesic or the pain relieving effects.
Thank you for that. The next question we have, a little bit of a different one. What about edibles? What about consuming or eating marijuana? Is that safer than smoking?
No. Until you know what you're doing. So edibles are the preferred route of administration for treating chronic illnesses like pain. But the biggest problem that has happened in every state that has legalized marijuana are a big spike in emergency room visits because of people overdosing on the edibles. The edibles are incredibly potent. And if someone that hasn't ever smoked or hasn't smoked cannabis recently or used cannabis recently takes one of these little gummy bears, they will be super high for 12 to 14 hours. They'll be paranoid. They'll be, and every state has seen a big jump in these emergency room visits, some of which are kids, because these look like gummy bears. So you have to be particularly careful with the edibles around children. But the other thing that people are unaware of is that the edibles take around 3 or 4 hours to have their peak effect. So what the other thing we see happening with the edibles is people take a little bit of a gummy bear or a brownie or whatever, and they wait about a half hour, it doesn't do anything, and then they eat the rest of it, and it still hasn't done anything, so they take the second one, and then it starts working. And they get higher and higher and higher, and paranoid and delusional, and it really is scary for someone, especially that is cannabis naive, to get that high, because they really will then often end up in the emergency room or hospitalized for a workup to try to figure out what's wrong with them.
It is probably better for the lungs if we only care about
right. Yeah.
but maybe not for the whole person.
And it's better because that when you get the right dose of the edible, it'll last a lot longer. And when you take it orally, you don't get that big increase in the THC level that makes you high. So again, as someone who's trying to teach people how to use this appropriately medicinally to treat pain, I'll have them use edibles as their preferred route, but start at a really, really, really low dose and go up very, very slowly, and be aware of how long it takes to work. Because this is, again, one of the things that we see. People think that because they don't get an effect within the first 30 minutes to 60 minutes, that they should eat a second gummy bear, and therein lies the problem, because it just...
Well, and there's really no, at least in many states, I think, regulation over what the dose would be in that gummy bear, is there?
Correct. Again, that'll be one of the good things about the new law in the state of Michigan, in contrast to the old law that was supposed to be a medical marijuana law, is we will have much better provisions for testing all the cannabis and labeling it so people know exactly what they're getting. They know the strength, they know what concentration of THC, what concentration of CBD. Right now, some of the better dispensaries in the state of Michigan are providing that information to patients, but that's not in any way mandated, and people don't generally know what they're getting.
It's really, really fascinating information here. What does the research show about the use of medical marijuana for pain or nausea relief?
I really talked about it already. I think that we used to think that it was the THC component of marijuana that was necessary for pain, and now we realize that CBD might be at least as important, if not more important. It probably is the THC component that helps nausea. The way THC works to treat pain is it actually makes everything, all sensory experiences, less unpleasant than they would otherwise be. But it actually is more of what we call a dissociative agent. And it turns out that opioids work in much the same way, is that neither opioids nor cannabinoids actually do anything to your pain. You just don't care as much about it. But this is why we worry about adolescent use, is when people start using marijuana, they don't just not care about their pain, they don't care about other things in life, and they have amotivational syndrome. So all of us that are promoting the legitimate medicinal use are really worried about adolescent
And I think
exposure.
it's important to point out
Right.
that it's not treatment for the underlying condition per se. It's some people think marijuana might cure certain things, and it doesn't. It just helps alleviate some of the symptoms that you have, and it's important to distinguish that.
Correct.
This is an interesting question to follow on from that with regards to the effect of marijuana. Are you seeing any academic changes with students who use recreationally?
In more recent research, we haven't, to my understanding, seen big impacts on academic achievement. I think that there is a cultural shift happening where in prior decades, marijuana users might have been seen as like stoners and that kind of subculture.
Stigma.
Yeah, exactly. And I think as it's becoming more normative to use, people aren't necessarily viewing it as that way. So I think that's where we're seeing that shift in academic consequences. But also, recent research from Monitoring the Future study here at Michigan, which I was a part of when I was a doctoral student, did find that there has been a fairly substantial increase in college students using marijuana for the first time that they're just recently finding. So it'll be interesting to track that over time if it is having an impact on college students, because we are seeing a pretty big increase in first-time marijuana use among college students where we didn't see before.
The next question that we have, this is an audience question from Facebook. I'm worried about the reproductive implications for our young folks and their children-to-be. Thoughts?
That's a legitimate concern. There are data suggesting that that there may very well be developmental issues associated with smoking marijuana during pregnancy. So I think people should not do that or be aware that that is potentially dangerous.
Yeah, it's not in my line of research, but just from a personal note, I had a baby recently, and I went to a class on like a birth class and child-rearing class, and the nurse was saying that no amount of marijuana is safe from her perspective. I think in terms of alcohol use, there might be a little more variability, especially with breastfeeding. But from my understanding, I think they're not sure yet how much is safe, and so they're recommending not using any marijuana when you're breastfeeding or with child.
Okay, and the next audience question, is cannabis, CBD or THC being used to treat epilepsy effectively?
Yes, so CBD under the brand name Epidiolex was approved a couple months ago to treat Dravet syndrome, which is a rare childhood form of epilepsy. It's thought to be more broadly effective in a lot of different types of seizure disorders, but so far it's just approved for 2 rare types of childhood epilepsy. And that product that's approved is actually derived from the marijuana plant, but then they get rid of all the THC and all the other things. So although it is CBD or cannabidiol, more or less pure, it was actually plant grown, and then they get rid of all the other non-CBD constituents. So the kids that get Epidiolex are getting pretty much pure CBD.
Okay. The next question that we have, should people with chronic conditions avoid using marijuana?
I guess it depends on the chronic condition.
Yeah,
if you have a chronic lung condition, I would say yes. So the data does suggest that it can make loss of lung function worse. For instance, if you've got a chronic obstructive lung disease, or if you've got asthma, it can definitely cause increased irritation of the airways, could lead to more flare-ups, et cetera. So I would say, particularly if you're going to smoke it, use with caution. If you've got any, the other interesting thing, which I actually forgot to mention, is that marijuana actually can carry organisms. So for patients that are immunocompromised, there have been reports of transferring fungal infections actually by smoking marijuana. There's a fungus that goes by the name Aspergillus. So if you have a patient with any kind of chronic condition that impacts the immune system, it does set them up for risk for this potential fungal infection. It's definitely been reported. So that's another group in which I would avoid smoking marijuana.
And also, there's been a number of research studies showing that people that have a family history of schizophrenia should be cautious when taking marijuana, because it might bring about the onset of schizotypic symptoms earlier than if they hadn't have used marijuana. So there is a link with schizophrenia and marijuana use as well.
Yeah, that was the next question.
Oh,
So thank you for
okay.
moving on to it. Perfect.
Didn't see that.
The next question that we have, and this is a interesting one. It's legal, so doesn't that mean marijuana is safe?
Well, you could say the same thing about cigarettes,
Alcohol.
Lots and lots of things.
high-fat foods. I mean,
Yeah,
I think
yeah.
there's I think the personal health aspect of it you need to consider. That, yeah, I mean, is it better or worse than certain things? We don't really know that. I don't think there have been any deaths directly attributable to marijuana, as there have been with other, like alcohol and nicotine. Definitely see very high rates of deaths associated with that. But we don't know the impact on driving and other other kind of outcomes. So
Sure.
For certain trade-offs with certain classes of drugs, it's easier to make. So I am often asked to talk about cannabinoids versus opioids in the context of chronic pain. And that's actually pretty simple, because if you go down the list of all the problems associated with opioids and all the problems associated with cannabinoids, and you look at the benefit of both classes of drugs, cannabinoids win by a long shot. It's not even close. You cannot die of a cannabinoid overdose like 50,000 people in the U.S. are dying of an opioid overdose. There are good data suggesting that when states put medical marijuana laws in place, that the overdose rates go down by about 20%. And there are likewise good data that a lot of people are using cannabis legitimately to treat pain to come off of opioids, and many people can successfully do that. So in narrow areas where the two classes of drugs are easy to compare to each other with respect to the benefit and side effects, there's actually not a lot of data that opioids even work to treat chronic pain, whereas there's more data that cannabinoids do work to treat chronic pain. And the side effect profile of opioids is so much worse that it's pretty easy to make that kind of judgment. But for most other things, it's that all drugs, when you ingest them, have side effects and toxicity and dangers and problems.
And there is an addictive potential of marijuana. About 9% of users meet criteria for cannabis use disorder. I think almost double that number if you start in adolescence. So cannabis use disorder is a real thing. Is it worse? It's probably not worse than like opioid use disorder, but there are some people that do become addicted to marijuana, which a lot of people don't think that there is an addictive potential to that, but there is.
Fantastic. You answered my next question.
Oh my gosh.
Actually, you know what, Dr. Claw, you might have answered my next question. Is it possible to overdose or have a bad reaction to marijuana?
Absolutely. This will be seen in the state of Michigan when the law is fully operationalized and people start to really use it recreationally. At every state that has passed a recreational marijuana law or legalized marijuana has seen a big increase in these emergency room admissions and things like this. So absolutely, in part because the marijuana that's been bred and grown over the last 20 to 30 years is so high in THC content compared to, again, I will acknowledge I went to the University of Michigan in the 70s. So when I was smoking in the 70s, I was purposefully trying to get high. But again, the THC concentration of marijuana in the 70s was 1/20th, 1/30th what it is right now. And that is the component of cannabis that where almost all of the safety issues seem to be from the THC. So we've taken a drug and made it 20 to 30 times more potent, and we're exposing large numbers of people to it. So yeah, there's concern about that.
Okay, the next audience question, to clarify, does use affect the genetic formation of sperm or eggs? Do you have anyone who can talk on this?
I don't know.
And any questions that you guys don't feel comfortable answering, we'll get an answer and put that in the comments section.
I don't think the answer is known, actually. I don't think that good work, and again, the viewers should be aware that one of the big problems with cannabis is because of its still being a Schedule I drug, it's really put a damper on research. And until recently, the NIH wasn't even allowed to fund research that could show any beneficial effects of cannabis. So part of the reason that we're hemming and hawing with a lot of these questions here is that there simply hasn't been the good quality research done that needs to be done before this gets widely consumed as if people think it's safe and effective for everything that it's touted to be.
And it's challenging to do that kind of research because you can't, for example, give one group of pregnant women high doses of marijuana and another group low doses. I mean, there might be animal work that could look at that, but it's a challenging area of research.
Yeah, and here we have another audience follow-up question. This one is talking about research with regards to lung capacity. This person says, Harvard studies seem to show an expanded lung capacity with long-time users and that it's recommended for asthma. Depending on who grows your cannabis will determine the carcinogens put out when burned. and that it's a natural inflammatory, antibacterial, and antifungal.
Okay. Well, interestingly, at least from what I've read, the slight potential increase in your total lung capacity is probably related to small airways disease that then leads to air trapping and an inability to actually completely get out all of your air, which actually leads to what we would actually call hyperinflation of the lungs. I wouldn't say it's actually increased your capacity. And then, we see that same airway inflammation in asthma and other types of chronic lung diseases. So I actually don't view that as a positive. But there's, as far as I know, no evidence to suggest actually that it would have an either bacterial or antifungal effect, at least in the lung. And as I mentioned, it actually can carry with it organisms that can lead to infections in individuals with chronic immune suppression. So, yes, there is going to be variation depending on, where you get your marijuana from and how it's processed. But unfortunately, a lot of that, at least for the inhaled forms, is not really standardized right now. So without, an FDA lab that's going in and checking on a production plant regularly and checking to see if it's the same, even if you got it from the same grower. They could have some mold infect their plants, and it might be different one year from another year. That's just sort of the way, that's just sort of with any, I think, type of farm industry. But so if you don't have the regulation, there's just really no way to know about concentrations, contaminants, whether things are the same from year to year. So at least in my mind, it's still a potential lung risk.
Thank you for that. And the next audience question, since the law is to make marijuana regulation comparable to alcohol regulation, based on that, the health effects of marijuana should be gauged against those of alcohol. How do the medical experts view the health issues for marijuana based on those of alcohol? I deem alcohol far worse for teens and young adults, especially if it's compared to a daily or weekly use. Would the medical experts agree or disagree?
I think it depends.
Yeah.
I think if you're taking a very high dose of marijuana, especially the different trends in marijuana, like dabbing, for example, which is a really super concentrated marijuana, very high levels of THC. So if you're consuming very high levels of THC on a daily basis, again, it's hard to really compare. In some ways, they are kind of like apples and oranges. And I think another thing with young adults and adolescents is they're not typically using one drug or the other. There's a lot of co-use, using together. And I think as people get older, especially with marijuana users, they tend to and you'll see people that are like, oh, I don't touch alcohol, but I smoke marijuana every day. But typically in younger people, they are using different drugs. And so there might be some interaction effects with using drugs together, which could be a potential problem.
Okay. Next question from the audience. What effects, damage does marijuana smoking have on the heart as well as the lungs? Can anyone speak to this?
I'm actually not aware of anything.
Acutely, some of the only deaths that have been perhaps attributed to cannabis ingestion, there is, right after smoking, there's an acute cardiovascular increase in blood pressure and heart rate. And there are a couple case reports where this probably triggered a myocardial infarction or a heart attack in someone. So with the acute administration, especially someone that isn't used to it, it'll put their blood pressure up, put their heart rate up. And that if you have pre-existing coronary artery disease, that could be problematic. I don't think in general we think of the heart being an organ that is otherwise adversely affected with chronic administration, but in acute administration, that's well known to occur.
Okay, and the next audience question, can anyone speak to your opinion of marijuana in pregnancy in the first trimester?
Bad idea.
Yeah. This one, the next question that we have, Dr. Claw, I think this goes back to a question that you fielded a while ago. I don't want to drive while high. How long does it take for the effects of marijuana to leave my body?
So this is a really big problem that hasn't in any way been solved, is sort of the legal issues of impairment, because right now in most states, if you have a detectable level, you can be charged with driving under the influence. And you could have smoked, you could be a chronic smoker that's last smoked 30 days ago. But if you get in an accident where someone was killed in an accident, and because you were in the accident, you're going to get a urine drug screen, you can, and in some cases people are charged criminally, even though there isn't evidence that there was impairment from the cannabis at that time. We still, what we should be doing, but we don't do, is police should really be doing roadside impairment tests, because other than for alcohol, there aren't any other drugs that you can accurately say that the level corresponds to a certain amount of impairment. But there's a ton of prescription drugs that people are taking and driving. If people are taking opioids and driving, I don't want them driving. They're very impaired, but that's not illegal. That's right now, unless you can be charged with driving under impaired and someone. But in general, we're not doing wide urine drug screens in everyone that's in a motor vehicle accident to see all the different drugs they may have in their system.
Very interesting. The next question, what are the effects of mixing marijuana with alcohol, tobacco, or prescription drugs?
Well, with mixing alcohol, I was in a meeting with colleagues and they were talking about some of their research, and they were calling it greenouts, which are like blackouts with alcohol, and that people that were using alcohol and then marijuana, they might have higher likelihood of greening out. So I don't know if it's something about certain people are more likely to experience blackouts than others. So maybe there's an association with greenouts too. This isn't really my area of research, but that was just something that came up in a conversation. And again, with I think younger people, as their brains are developing, these different neurotoxic substances in combination tend to have more cumulative effects than in isolation, because they're interacting with different areas of the brain and different receptors, and so typically when they're using more substances together, it's more problematic.
The only thing we can say, I think, with some certainty about the combination, and I'm not trying to be pro-cannabis in this regard, but other drugs of abuse like alcohol, opioids, benzodiazepines, all work in the brainstem to decrease your respiratory drive, your breathing drive, and there's a high rate of overdose from all of those drugs and from combinations of all of those drugs. And a lot of the famous overdose deaths, the actors or people, it was co-administration of opioids with alcohol, with benzodiazepines. And so those three classes of drugs are known to be a deadly combination. Cannabis doesn't add, I'm not advocating throwing that in the mix, but if you're going to be doing poly-drug use, that would be the one that would be the safest of a bunch of unsafe things, because of the fact that it's not going to cause the respiratory suppression and the overdose. And again, the people have honed in on the opioid epidemic appropriately so, but there's still a tremendous number of overdose deaths from benzodiazepines alone, from the combination of alcohol plus benzodiazepines. And again, that is one of the only places where I think we can clearly say that cannabis wouldn't have the same safety issues.
Thank you for that. Dr. Hunt, here's a question for you. Can secondhand marijuana smoke affect non-smokers, including children?
Just don't have great data on that. I mean, we don't have great data on secondhand tobacco smoke, so now let's extend that one more. If we look at, I guess, tobacco smoke as an example, again, I mentioned smoke in general is not great. Even, having kids around wood-burning stoves is not great for their lungs, particularly, for instance, they have asthma, but can ultimately increase risk for chronic lung conditions. So if I was to guess and to extrapolate, I would say it's not great to have small children around any kind of smoke, regardless of the source. But the kind of, medical literature we have on it is just, that's not something a lot of parents are going to report. Yeah. And so it's just very difficult data to try to collect.
Thank you for that. We have another audience question. Are there comparable studies between chronic marijuana use and a lack of hitting your REM cycle, causing a full night's sleep to feel like almost no sleep at all? It doesn't matter if we can't.
Well, I mean, I haven't studied this directly. But I have been interested in this. I've tried to look at this in our data. We haven't been able to do it yet, but in talking about how we would set up this kind of study, it's interesting because I think if you go into a dispensary, there are certain strains of marijuana where they advertise that it will help your sleep. Some people might just say, oh, marijuana helps me sleep better, but we don't know what the effects are, how it may not always be a beneficial thing for your sleep. So I think, it's a little bit mixed in terms of how it does impact your sleep.
Let me just say something though. Yeah. Is that we've been talking about two specific cannabinoids, THC and CBD, that are in cannabis, but there are 80 of them, and 78 of them we don't know hardly anything about. So when we hear, so there are three different strains of cannabis: indica, sativa, and ruderalis. And what you'll hear from the recreational users is that the indica is more sedating and the sativa is more activating, keeps people awake. And if that is true, that probably was more true in the past before all the breeding of strains and everything. But when that used to be more true, it was probably some of those 78 other minor cannabinoids that were having those effects that we don't know hardly anything about. And so that's why it's so hard to understand, because THC would be directly somewhat sedating, and a lot of people that use medicinal marijuana for pain will primarily take it at night and find, at least by self-report, that it helps them get to sleep and it helps them stay to sleep. But I'm not aware that there have been good sleep studies showing that that's high quality, deep, the kind of sleep that we're trying to get people to have.
And after today's Facebook Live, we can also talk to our sleep experts like Dr. Chevin and see if they have any input on that as well. Next question from the audience: does cannabis affect the parts of the brainstem that control main body functions? No.
Again, there are no cannabinoid receptors in the brainstem. This is why it doesn't cause the respiratory problems that it does. So that's one of the only good things about, I shouldn't say the whole brainstem. The brainstem is big, but there are no cannabinoid receptors in the respiratory drive centers. For a lot of the areas of the brainstem are totally devoid of cannabinoid receptors, where they have a lot of opioid receptors, a lot of other drugs that are affected. So.
And the next question that we have is with regards to K2, spice, synthetic marijuana, synthetic cannabinoids. How harmful are they?
Quite. They really should be put, they're called synthetic cannabinoids because in assays they'll bind to the cannabinoid receptor, but they are so different than what we've been talking about that I think people should really put them in an entirely different, a lot of issues with those drugs, no therapeutic benefit of those drugs. So I really think those should be put over to the side as just bad.
And distinct from
very distinct from marijuana. Is that I think we're sort of doing cannabis a bit of a disservice by calling those drugs synthetic cannabinoids.
Mm-hmm.
Then the next question that we have, and I don't know if any of you can speak to this: can the essential oils of the cannabis plant, such as RSO, cure conditions such as Crohn's and cancer?
This is another big problem with cannabis, is the route of administration. So people are taking cannabis in all sorts of different ways. They're using it as a topical, they're using it in tinctures, they're using oils, they're using edibles. And what we do know about cannabis is that it's very poorly absorbed, and very poorly bioavailable. So if you put it on your skin and you don't put something else with it, like alcohol or something that's going to drive it through your skin, it won't really have any known topical effects, even though a ton of people are using topical CBD and products. Same with the oral routes. We're recommending an oral route of administration, but one of the big problems with cannabis is there's tremendous differences in bioavailability, and only the average person, if they take a gummy bear or an oral cannabis product, only about 10% of that will get absorbed, and the other 90% will just pass through. But if they take that same gummy bear with a fatty meal, 30% will get absorbed. So this is a big problem with the edibles, is that the amount of an edible that you get will be highly dependent on when you eat a fatty meal, or if you eat a fatty meal. Much more will get absorbed if you eat it with a fatty meal, or if you eat a fatty meal right after. And that's a big difference in, especially with THC, a twofold or a threefold difference in THC concentration is the difference between maybe the amount that would cause good pain control and the amount that would give you high and paranoia. There's not a big, wide therapeutic window for THC. There's a fairly narrow range that would give a therapeutic effect without a toxic effect.
Okay, and the next question is with regards to, does marijuana use lead to other drug use?
I think people refer to that as the gateway hypothesis, and typically we find that that is not necessarily the case. There's nothing necessarily about marijuana that makes people want to try heavier drugs per se. I think the argument maybe stems from being around marijuana users, like the social context. But I think the research points that it isn't necessarily something about marijuana that leads to other heavier drug use.
And the next question, this is one I feel like we touched on with you, Dr. Hahn, and you, Dr. Claw, but if we could touch on it one more time. How is eating and drinking foods that contain marijuana, such as edibles, different from smoking?
It will be somewhat less predictable what the effect will be depending on what else you eat and drink. Even the orally available prescription drugs that we have, the THC analogs that are now approved in the United States for treating AIDS-induced anorexia and for post-chemotherapy nausea and vomiting, those drugs are very poorly bioavailable. That's just a known fact. And those drugs would have all the same problems as a gummy bear. Is that if you take that drug with a fatty meal, 2 to 3 times as much of it will get absorbed. So that's still a problem, and there's a lot of drug companies that work on drug delivery systems that are trying to figure out a way to put either CBD or THC or both into a drug and make it more predictable absorption, so you know that if someone takes that pill, that they're always going to absorb 20%, or always going to, and then you know what the therapeutic effect and the toxicity will be.
Do you think that the relative dose absorbed is more reliable when it's smoked?
Yes, it is more reliable when it's smoked.
So it's a bit of a catch-22, right? So you're going to get a less reliable dose with the oral administration, but there's the risk to the lungs from the smoke and the other carcinogens with smoking. So
yeah, I don't even think it's, I wouldn't even put it that way, because I think we're strongly recommending against. The only time that I would say someone that's trying to use it medicinally should vape, not smoke, is when they first are trying a little bit of it to try to see like what kind of a gummy bear they might want, but putting their toe in. But for chronic administration,
nobody yet.
I don't, even vaping, I think is going to cause a lot of the same.
There's other compounds in the
yeah,
vape.
and it's just far better if people are using it chronically. It would be far better. Tinctures, oils, edibles. You're not having any respiratory issues.
Because that doesn't necessarily filter out all the bad things.
No, it doesn't filter anything
exactly.
out. No.
So it looks like we've gone through all our questions, all our audience questions, but I want to make sure we get everything out of today. So I want to go down the line and ask you, do you think there's anything we've missed that you'd like to talk about? And what is a takeaway that each of you would want our audience to know, to take away from today's session? If I could start with you, Dr. Marks.
Yeah, I think in relation to the adolescent brain and marijuana use, just what we tend to see as the earlier, heavier use is more problematic. So delaying use, much the way we have, delayed alcohol use to age 21. Pushing back the age of first use is really important from what we've found in the literature. So yeah, just delay, delay in youth.
So I mean, we talked about it. We are lacking some of the data, long-term data, although, the interesting thing is that with respect to the lungs, the tobacco companies have been arguing for years that we didn't have data that conclusively linked cigarettes with lung cancer and things like that. So, I think just from a respiratory health standpoint, there's just no safe kind of smoke, regardless of what the compounds are. But marijuana in particular, we know it does irritate the airways. We know that it can make other respiratory conditions worse. We talked about the potential for infections, carrying infections in patients with chronic immune conditions. One thing I didn't mention, there actually is some other, the data's, again, none of the marijuana data is great, but there are some reports, and I've actually seen this, which is why I tend to believe it. There are some case reports where marijuana and smoking marijuana can lead to bulla in the lungs or even holes in the lungs. And I actually saw this in a patient several years ago, admitted to the hospital, a young gentleman, no other really risk factors to have a hole in the lung other than he'd been smoking joints. And so that is another kind of rare side effect that has been reported. I'm not aware of any data to suggest that marijuana is good for the lungs. And I think otherwise, at least from a lung health perspective, it just represents risk, not only to the individual who may be smoking, but also, as was touched on, I think just in general, the concept of exposing others to secondhand smoke is always, at least from a theoretical standpoint, a concern.
So not all cannabinoids are created equal. That people should be aware that there's a lot of stuff in cannabis, the two main ones, CBD and THC. I'm extremely optimistic about the therapeutic potential of CBD, and I think that's still being explored, and I'll bet we find a lot of important uses for CBD. I'm cautiously optimistic that low amounts of THC in the right settings can be helpful, but what we're seeing is that if people don't watch programs like this or don't get some kind of medical advice and they just go to a dispensary, they're going to get the high THC forms that are probably not of any medicinal benefit for anything and are going to have a lot of, again, side effects. Now, if someone's a recreational user and they're trying to get high, then so be it. But I think we're trying to give a perspective of how people might use this more from a medicinal standpoint, or if they're using it recreational, at least be aware of some of the potential side effects associated with it. And again, we're not seeing, in part, I think, because very few U.S. physicians have had any training in any of this. So they're not getting, the normal sources of information for a patient are not available.
So what you're saying is let's reconvene in 5 years for another Facebook.
Oh, it's in 2 years, because this field is moving very rapidly. Yeah.
Oh, so that's very interesting to me too.
Yeah.
Well, I appreciate all your expertise. I appreciate you fielding all this hugely wide variety of questions. Thank you for the questions from our audience. If you've just tuned in, if you tuned in halfway, this will be on our Facebook page, and we'll also be putting it up on the Michigan Medicine YouTube channel as well. So Dr. Martz, Dr. Han, Dr. Claw, thank you so much, and thank you to everybody who was a viewer.